Hello, everyone. Welcome back to Backyard Musings. I'm Steve,
And I'm Scott.
and together we're Backyard.
We're
Musings.
Backyard Musings, and we're the Science and Technology channel.
I'm a little bit flustered because we lost the Pope today, and I personally believe that he was a disciple of Christ. He obeyed the commandments, as far as I can tell, and he loved the Savior, and he was a do-gooder. Did a lot of good. So it's kind of sad that he passed away.
And he had an amazingly large following. What did I read this morning? 1.6 billion Catholics in the world. That's a lot.
That's a lot. That's
So,
about 10%.
maybe not all of them.
That's about 10% of our. Well, we're 10% of their church.
10% or
Yeah, or
1%.
1%. Oh,
But the idea is maybe not all of them liked what the Pope had to say or did, but he was still their religious leader. So.
He did good too. He did a lot of good.
Yeah, he had some kind of out there. He got involved in climate change and that kind of stuff, which is kind of weird. But
yeah, that is weird.
But he's entitled to his opinion, I guess, just like anybody else. So it's all good.
So I'm more his loss. Yeah,
he's in a better place. That's all we can say, right?
Definitely.
Yeah,
absolutely, definitely. All right. In just 12 weeks, nature-based activities like gardening, care farming, and mindfulness in the fresh air significantly boosted the mental health of over 200 participants in England. These community-rooted programs, part of a national test in green social prescribing, delivered improvements on par with traditional therapy, especially when people actively engaged with nature and did so with others. The research was published in Health and Social Care in the Community on April 1st, 2025. I don't think it's an April Fool's joke. I think it's a legit article.
Just the timing of this?
Just the timing, yeah. Would you like to know more?
Researchers have found that the nature-based activities can improve mood and reduce anxiety in people with mild to moderate mental health conditions. We know a few of those, right?
Yep.
In as little as 12 weeks. The findings come from a UK government-backed initiative aimed at improving mental health care through green social prescribing. 7 pilot sites were set up across England, including one in Humber and North Yorkshire, the first to publish results from the national program.
Okay, green social prescribing involves healthcare professionals referring patients to nature-based community activities, such as gardening, walking groups, or outdoor mindfulness sessions as a way to support mental health alongside traditional treatments. While still in the testing phase, early results suggest these programs could become a valuable addition to mental health services across the country.
In the Humber and North Yorkshire programs, more than 220 participants took part. Their mental health was assessed before and after joining structured activities like horticulture, care farming, which I'm not exactly sure what that is.
I think that's like the community garden. Where you go and you.
Oh, okay.
Yeah.
You take a little 10 by 10 piece of land. And
it's out in the park. Yeah.
Yeah. Everybody has their own thing. So
yeah.
They used to do that down in San Bernardino. And I guess elsewhere too. Exercise was one of the programs, outdoor crafts, and mindfulness sessions. Mindfulness.
Yes.
Okay.
You know what that is? That's where you get into the moment where you can feel that breeze on your arm, on your hair, and on your arm.
I got to get into the moment.
You got to concentrate. Yeah, you just concentrate. You feel the clothes on your body. You just
before or after I put them on.
After.
Okay.
Yeah, after.
The majority of participants took part in the program weekly between 1 and 4 weeks, 5 to 8 weeks, and others between 9 and 12 weeks. So pretty long studies.
Mm-hmm.
The team used the Office of National Statistics measures of personal well-being as well as the hospital anxiety and depression scale. Had no idea that it was that. And that's what is that abbreviated to? HADS.
Mm-hmm.
To understand if participants had made improvements.
Yeah, I guess when you go to a hospital, you get depressed,
Well, I can see that. Or, you've heard about people that, they have a good life. They're working. 40 years happens in the workforce. They retire. They go home. They don't have any hobbies. They don't have any family. They just sit in front of the TV and they die.
Mm-hmm.
So I'm an outdoor kind of guy. I mean, I don't mind sitting in front of the TV for a little while, but eventually I got to go out either in the garage or I got to go outdoors and fishing, hunting, just,
gardening.
Yeah, just enjoying God's green earth, right?
Mm-hmm.
And so, yeah, you got to have a good mix. But I would hope that people would do that because I guess that, it's like people in retirement homes. You've known people that have been in retirement homes, right? If they don't get out, they're just, they stagnate.
Kind of languish.
So it's too bad. So
hand me one of those plants. Sure.
Just one?
Yeah, we got this over the weekend, and we're going to be planting plants. I don't know when. Maybe tonight we'll do it for family meeting. That would be a good family.
A pepper or tomato plant?
It looks tomato is what it looks like.
Okay.
Yeah, there's a pepper right there. We got about a dozen. My wife got a dozen. We'll just. I think tonight we'll just.
Oh, these are tomatoes. Yeah,
the whole family.
Fuzz on the stalk.
The whole family will just do it.
Yeah, those are good starters. Where'd you get those?
Home Depot. Oh. I pulled the weeds out of the planter, so that was my job, and I'll probably help tonight.
Nice.
Cameron picked up the weeds and put it in a thing. Okay, the signs of improvement were similar to those seen in short-term cognitive behavioral therapy, where someone might meet one-to-one with a therapist over a period ranging from 6 weeks to a year or more. Professor Peter Coventry from the University of York's Department of Health Sciences said, quote, "We have known for some time that nature has a positive impact on health and well-being, but in more recent years, a stronger evidence-based has grown that proves this to be true for mental health in particular."
The study showed that these positive impacts were seen in all ages, which range from 18 to 85. So that's pretty good widespread. And across genders. Researchers are now calling for more investment to be made to support these community activities and the employment of green social prescribers that GPs, general practitioners, okay, and other health and social care professionals can refer their patients to. So they're going to suggest you go out and garden, or go out and take a walk, or
nice and peaceful.
Go to the park if you have a park close by. So,
unless you get mugged by an illegal alien.
Yeah, we don't want that. Yeah, we don't want that. So, but we're getting that's getting cleaned up. So
trying to. Yeah. So the Supreme Court's stepping in. All right, Trish Darcy, research associate from the university's mental health and addiction research group, said, quote, "This intervention might not work for everyone, but through an initial exploratory conversation," that's a big phrase there, "a social prescriber will discuss with a patient or user of the service if nature-based activities will be suited to them. And for that choice to happen, we need more investment to support these community-based activities."
Across the board, participants reported improvements in well-being and mental health. But participants who took part in longer programs, typically 9 to 12 week, or took part in activities related to horticulture and care farming, showed greater improvements in mood and anxiety levels compared with those involved in shorter programs, 1 to 4 weeks, or in activities such as outdoor crafts, creative and mindfulness-based sessions, or sport and exercise. Yeah. Okay.
Anthony Hurd, Umber and North Yorkshire Greens Social Prescribing Program Manager, that's a big title, said, quote, "This work has not only shown the positive outcomes that nature-based activities have on mental health, it has also highlighted the role that community-based organizations play in supporting the health and well-being of communities. As healthcare begins to move more into the community and with a focus on prevention, the community-based organizations delivering activities such as gardening, care farming, and walking groups need to be recognized as key players in our national health service and be resourced appropriately."
Yeah, so even if you're not able to get out, let's say you're confined maybe to a wheelchair or a walker or something, and you can't really get out, you could still, like you do here, you could still buy a few of these, plant them in a box, put them in a patio area or in a near a window, and it gives you something to live for, right? I mean, you got to care for this thing, or it's gonna die, it's gonna dry up.
Yeah.
So it gives you something to, instead of coming in, turning on the TV or picking up the phone or turning on a tablet or whatever, it gives you something to stimulate your mind to, know you have to do something, accomplish something. Somebody's depending on you. Maybe
it's pretty cool to see it grow from that little thing up to big with
exactly
tomatoes branching out.
Exactly.
And this is like not quite food stores, but you can incorporate it into your meals. You
Right.
grow basil and tomatoes. Now you got bruschetta, which is delicious.
Right. You could grow a cow.
You could, or grow
And
an
you'd have
olive tree and
steak.
press it. Get some. Yeah.
So yeah, no, I think this is cool.
All right, folks. Thanks for joining us.
Take care, everyone. Thank you.